The goal for any couple going through IVF or in vitro fertilization is having a healthy baby. And doctors say they're delivering more of them thanks to advances in genetic testing. Fertility doctors are calling new breakthroughs in PGS or pre-implantation genetic screening a game changer.
He's what I call a sucker baby, the kind that makes you want to have a million of them.
Maybe not a million, but Susie Bramson is going to try to give her son Jonas a brother or sister.
Do you remember when they were smaller? Before they had even grown on here? Yeah.
The road to having Jonas was a bit challenging at 40.
Once I met Jose, I found my match, then we definitely wanted to have a child. However, I met him sort of later on in my life, and so it just so happened that by the time, a year after we met, we were ready to have kids. It just so happened that our fertility profile was a little complicated, and so the only option, according to our fertility doctors, was to go with IVF, so that's what we did.
Before starting her IVF cycle, Bramson's fertility doctor suggested she have PGS, or pre-implantation genetic screening.
By doing PGS, or pre-implantation genetic screening, we can take a few cells from that embryo and then know what number of chromosomes that embryo has. So ruling out missing or extra chromosomes, abnormalities that would result in either a miscarriage or a failed implantation.
PGS has been around for more than a decade, but studies show it's more effective now because it's more precise.
And on average, success rates is dramatically higher.
And it can better reduce the risk of having more than one baby. This is all possible because of a trifecta of changes, which have some of the top IVF specialists in San Diego excited.
I think now we can smile a lot more, truly.
The first big change in PGS, instead of transferring a fresh embryo, doctors can now safely flash freeze the embryo and wait a month to transfer it.
If you transfer fresh embryo, the patient was just undergoing stimulation. Their hormone levels are very high, typically 10, sometimes 20 times higher than physiologic levels. So most studies indicate that attachment of the embryo to the wall of the uterus may not be as good.
Second, a biopsy on the embryo is performed when it's 5 days old instead of 3, which is safer for the embryo and also allows for more cells to be collected to check for abnormalities.
It's more reliable because now you're taking 4 to 6 cells as compared to just a single cell.
This is the lab where embryologists perform biopsies. Once the 4 to 6 cells are removed from the embryo, they're stored in a freezer and then sent to another lab in dry ice where they can get PGS. The last big change in PGS,
We have an extra chromosome, whereas this chromosome was missing.
Is comprehensive screening on all 23 pairs of chromosomes. The older method only analyzed 5 chromosomes.
If you transfer an embryo without testing, you have at least 25% chance that the embryo will be abnormal. And we are talking about young, healthy, 25-year-old egg donor. If you are talking about 42-year-old female, that chance will be as high as 80% or more. So why would you want to transfer an embryo that has more than 80% chance of being abnormal?
IVF has contributed to women having twins and triplets. With PGS, it allows doctors to better select which embryo has the best potential, reducing the risk of having multiples.
I was not interested in having multiples.
Cost is a factor for many. PGS adds another $5,000 to the price tag of IVF, which is typically $15,000.
It's an expensive process to begin with, and that added expense for the level of security that you get. But not only that, it might save you money in the end because if you're only implanting embryos that are chromosomally sound, you may avoid transfers that would have occurred otherwise.
Bramson plans on adding to her family next year with the help of PGS once again.
He's just been the most amazing, amazing little baby. I couldn't have asked for a better baby.
Kaushal Patel, San Diego Union Tribune.